Sustained pressure medicine based on genetics helps us understand how small changes in our genes can influence the health of our bones, muscles, and joints. Today, we will explore how genetic polymorphism analyses, or genetic variations, can improve treatments in orthopedics. Next, we will show an example of how genetics can help prevent bone problems. In this case, we will visualize how variations in a gene related to collagen determine the quality and strength of bones. It has been shown that patients with certain variants of this gene have a higher risk of osteoporosis and fractures. By conducting a genetic analysis, it is possible to identify at-risk individuals and initiate personalized preventive treatments. 55-year-old patient with gen code long 3310 who frequently attended consultations for spontaneous fractures. Upon performing genetic analysis, she was diagnosed with a variant alteration of gen COL1A associated with collagen disorders. With this information, a preventive protocol was developed that included epigenetic therapies, dietary adjustments, personalized selection of vitamins and minerals, and specific exercises, significantly reducing her recurrence and risk of fractures that the patient frequently experienced. Another important example of health conditions where genetic analyses are essential is rheumatoid arthritis, an autoimmune disease that affects the joints. In this case, analyzing genes can reveal genetic predisposition and help prevent irreversible damage. A 40-year-old patient presents with joint pain and inflammation in the knee with a suspected diagnosis of gout. According to the database, the patient with gene long code 8723, when the genetic analysis was performed, he showed a predisposition to rheumatoid arthritis. Thanks to this detection, he began a personalized treatment based on drugs according to his genetics, epigenetic therapies, and other procedures according to the patient's genetics, before the joint damage progressed further, managing to maintain his quality of life and delay the progression of the disease. In surgical procedures, such as joint replacement, understanding polymorphisms in genes related to inflammation allows for the personalized adjustment of anti-inflammatory medications, vitamins, minerals, foods, and lifestyle choices, leading to optimal patient recovery. A 65-year-old patient, code gen long 5864, before a hip replacement, was genetically determined to have a variant of a gene that predisposed him to inflammation. With this information, his pharmacological treatment, nutrition, minerals, vitamins, and epigenetic therapies were personalized to mitigate the anti-inflammatory process, and personalized physiotherapy was applied, which improved his swift recovery and avoided complications, as evidenced in other patients. In athletes, genetic analysis can identify the types of collagen, muscle fibers, and other factors associated with cartilage degradation. This information is crucial for protecting joints after traumatic injuries, as well as for preventing injuries and enhancing the longevity of athletes. A professional soccer player with gen code long 9632 suffered a cruciate ligament injury and was discarded by his team. He chose to undergo genetic testing, which revealed genetic variants linked to his recurrent injuries. This insight enabled a tailored treatment plan that included epigenetic therapies, nutritional supplements containing collagen precursors, and physical therapies aligned with his genetic profile, leading to his successful recovery. Inspired by his example, his teammates began to utilize genetic testing preventively to reduce their injury risks and extend their sports careers. A key aspect of medical practice is understanding how genes affect the way the body metabolizes certain medications. With this information, doctors can adjust the doses of pain relievers and anti-inflammatories to avoid side effects in orthopedic patients. A patient with a fracture followed his doctor's recommendations for several months, using a combination of anti-inflammatories, but without improvement. He visited our clinic and was registered in the database with gene code LON 6742. The genomic analysis revealed genetic variations that enabled us to adjust his dosage, resulting in optimal pain control and rapid recovery without any adverse effects. In summary, genetic analysis enables us to understand how various genetic polymorphisms are essential for personalizing orthopedic treatments. By rationally using medications, vitamins, minerals, and epigenetic therapies at precise doses and frequencies, we can enhance the quality of life and accelerate patient recovery. In orthopedics, genetics not only aids in the treatment of diseases, but also allows us to anticipate, prevent, control, and manage them more effectively.